Hey everyone, and welcome back to another video. There's an idea that when it comes to hair loss treatments, people of East Asian descent respond better than other ethnic groups. This is typically called the Asian hyperresponder theory that many on hair loss forums as well as some of academia point out to be a real occurrence. Now, when it comes to the difference in ethnic groups and hair, I think it's quite obvious that different groups of people tend to have different types of hair. And it may very well be the case that there are genetic factors that exist beyond the phenotype of the hair. Now, in this video, I am mainly referring to 5-alpha reductase inhibitors, such as finasteride and dutasteride. I'm not going to delve into minoxidil and its ethnic response rates. That would probably be a video in and of itself, so please wait for that whenever it comes out. Now, I'm not here to completely argue or debunk that there is a complete and total zero genetic response rate to finasteride and dutasteride. Mainly, though, I'm going to make the argument that, at least when it comes to different ethnic groups and the so-called Asian hyperresponder, I think it's a bit overblown, and whatever advantage that these so-called Asian hyperresponders are getting, it isn't due to some sort of weird and intricate reaction to 5-alpha reductase inhibitors, but mainly it's a feature of their hair that they've always had since birth. That is, it's the shape of the hair, its thickness, the way that it fills out on the scalp, absent of any sort of treatment when it comes to androgenetic alopecia. So if you were to compare certain ethnic groups at their baseline pre-androgenetic alopecia, you may very well find that they already had dense, thick hair compared to other ethnic groups. And it's the idea that when these hairs are to come back in their normal anagen phase by using 5-alpha reductase inhibitors like finasteride and dutasteride, these hairs are able to maintain a better coverage and just have a much more aesthetically pleasing result at a similar Norwood level, if that makes sense. So we're going to be doing a sort of comprehensive literature review and looking at some of the literature and some of the research that exists and what it may highlight in regard to this so-called East Asian hyperresponder theory. The comprehensive literature review by Conchano Liriakal and Punkianit Shochuanit, hopefully I said those names right, provides a thorough analysis of the unique characteristics of East Asian hair, highlighting several key aspects. It discusses the genetic basis for hair straightness, with a significant association identified between the EDAR37A gene variant and hair straightness in East Asians. In contrast, Europeans have a different genetic influence on their hair straightness, specifically the TCHH gene variant, illustrating distinct genetic pathways in different ethnicity. The study delves into hair pigmentation, focusing on the role of eumelanin and pheomelanin in determining hair color, particularly in East Asian hair. Eumelanin and pheomelanin, by the way, are two primary forms of melanin, the pigment responsible for the coloration of skin, hair, and nails in humans and other animals. And these types of melanin are produced in cells called melanocytes through a process known as melanogenesis. Now, the amount and type of melanin produced by an individual are determined largely by genetics, but environmental factors such as exposure to sunlight can influence melanin production. Anyway, going back to the literature review, it mentions that the melanocortin-1 receptor, or the MC1R, and its unique variants in Asian populations, especially the ARG163GLN variant prevalent in East and South Asians, potentially influences pheomelanin production. Now, regarding the melanosome size and density, which contribute to hair pigmentation, the review points out that East Asian hair shows different melanosome characteristics compared to African and Caucasian hair, contributing to its own unique coloration as well as texture. Additionally, the review goes on to note that East Asian hair exhibits the fastest growth rate compared to other ethnicities, with African hair types having the slowest growth rate and Caucasian hair being somewhere in between. The study correlates these growth rates with hair structure, particularly the cuticle interscale distance, and observes that the cross-sectional area of hair seems to influence its growth speed. Now, in regards to androgenetic alopecia, Senchuanet and Lerniankel find that studies conducted on Asian populations have reported a lower prevalence of androgenetic alopecia in male and female versions compared to Europeans. Researchers find that the onset of androgenetic alopecia in Japanese men, for example, occurs approximately 10 years slower than Europeans, and the prevalence is about 1.4 times lower in each decade. This indicates a significant difference in the onset and progression of androgenetic alopecia between these ethnic groups. So this is just me theorizing and stepping in for a moment. It could mean that some groups probably have a larger window in their response time to treating androgenetic alopecia before it becomes too severe. But say if you were to control for that response time and just take comparable Norwood scales, maybe that would show that people still respond similarly. But again, it's that difference in the progression rate between different groups. So when looking at that alone, that could be an advantage for some Asian populations, but also some Caucasian populations too. And this difference in the rate of miniaturization can possibly manifest itself in different patterns of hair loss. Because if you remember in another video that I made about the BASP classification system, which was conceptualized to be an improved version of the Norwood-Hamilton scale, we can see that in some people, they have a slower and more gradiated miniaturization response rather than the basic response as seen in the Hamilton-Norwood scale, where you just progressively move through each and every single Norwood level. But in the BASP classification system, it's kind of like you have a little bit of miniaturization here, and then progressively gets it worse. But nevertheless, those hair follicles are still active and can respond to treatment. But we'll be looking at some studies later on in this video because it will sort of show that yes, in some populations, they have a sort of gradiated miniaturization. And that means that miniaturization in some areas are worse than others, but nevertheless, there are still active hairs. But let's jump into another study. From another study titled, quote, Frequency, Severity, and Related Factors of Androgenetic Alopecia in Dermatology Outpatient Clinic, Hospital-Based Cross-Sectional Study in Turkey, unquote, found that the prevalence of androgenetic alopecia was reported to be 50% in Caucasian men and 19% in Caucasian women. Both prevalences were reported to be lower in Asian, East Asian, and Black or so-called Sub-Saharan African men than in Caucasian. And there are more studies that point out the difference between ethnic groups and the dynamics of their hair, or at least what it tends to be like. Again, we can look at another study, quote, Androgenetic Alopecia, Pathogenesis and Potential for Therapy by Justin A. Illis and Rodney Sinclair, as well as Stephen B. Harp. And here, this study discusses the prevalence of androgenetic alopecia in white males and highlights about 30% are affected by the age of 30, increasing to 50% by the age of 50. It also notes that white males are significantly more likely to develop androgenetic alopecia compared to Asian and African men. Another study titled, quote, Characteristics of Androgenetic Alopecia in Asian by Woo Son Lee et al., unquote, indicates that androgenetic alopecia in Asian men, particularly in Japanese and Korean populations, has a later onset and lower prevalence compared to Europeans. Asian hair is characterized by its unique density and thickness, which are significant factors in the manifestation and treatment of androgenetic alopecia. So there are factors unique to Asian hair that make it dense in its own way, separate from other groups, if that makes sense. And this study was referenced in the Senchuanet and Lerniankel comprehensive literature review. So we can actually delve deeper here in this paper to see how different ethnic groups of the Asian population, how they tend to deal with androgenetic alopecia, its prevalence, and its severity, and we can sort of make that comparison with Europeans. So when looking at Japanese men, androgenetic alopecia is less prevalent overall in the population, and typically, if it is to occur, it begins about a decade later than in European men. The incidence is notably lower in each decade of life when you're comparing these two groups. Now, the prevalence of androgenetic alopecia in Korean men is lower than in Europeans, and it also increases with age. So that's similar to both groups, by the way. So the prevalence for both European men and Asian men in general, as you age, right, you'll see more people going bald. But it's just that that frequency is less in this particular Asian population, Korean men, that is, and overall in Asian men. In Korean women, the prevalence also increases with age. However, they do have a lower prevalence of androgenetic alopecia compared to European women. Androgenetic alopecia prevalence in Chinese men is lower than European men, but also similar to Korean men. And in Chinese women, the prevalence is lower than in Korean and European women, but the difference might not be that great. Higher prevalence of androgenetic alopecia is observed in these regions, with Singapore showing up to 63% prevalence in older age groups, and Thailand's prevalence closely approaching that of Europeans. Now, Indian males show a less extensive balding pattern compared to other Asian populations, with type 2 being the most common until the 6th decade, or people's 60s, men in their 60s. When comparing men with European descent, studies showed a predominance of frontal baldness and varying androgenetic alopecia patterns increasing with age. Now, I want to take a bit of a quick sidestep. There was a recent 5-year long-term dutasteride androgenetic alopecia study that was put out in South Korea. And what it observed was the differences between the basic hair loss pattern, so the classical Hamilton-Norwood pattern, and the basic and specific hair loss patterns. Now, just to give a quick rundown, the basic hair loss pattern is typically you're just progressing through the Norwood states. It's just the miniaturization occurs at the frontal area of the hairline and also at the crown as well. Now, the basic and specific joined hair type, so the basic specific hair type, is like a combination of basic and specific variants. The specific variance examines that there is a bit of miniaturization here and there, but overall you tend to fit within this specific sort of Norwood, or I guess you can say basic Norwood classification, but with a bit of an additive, right? So let's say you're a Norwood 1, however, you have some slight thinning at the crown. Or you're a Norwood 2, but you're not fully a Norwood 2, you still have some sparse hair at the hairline area, or maybe your vertex area as well is like thinning. Those are the BASP, or the basic and specific hair type hair loss patterns. And what it found was that people who tended to have the specific types, so they tended to have miniaturized areas, but those areas still had active hair follicles, they responded better to dutasteride treatment, such that they actually got more regrowth than people with the basic hair type. It didn't say that the basic people regressed and got worse, they just didn't see any significant areas of hair regrowth. So once again, I guess when it comes to looking at this quote-unquote hyper responder, it's not like the drug itself there's like some sort of sensitivity to finasteride and dutasteride that causes Asians to react better. It's just that their hair follicles are still somewhat active, and there's a wider window so that this particular ethnic group can seek treatment compared to other groups. So they have more time to act on their hair loss than other groups do, but it looks like the differences, at least when I go through all these studies, this particular sort of genetic advantage is just so small that in reality, I think there's a better explanation. Again, I'll touch on that later on in the video, but to kind of just say that now, that explanation is mostly in the dynamics of the hair shaft that Asians have. The wide, thick hair shafts that sort of occupy more space and give a unique sort of density that when Asians do go back to their baseline anagen hair growth at comparable Norwood levels or BASP classification Norwood levels, they tend to have a much better aesthetic look than Caucasians and even other sub-ethnic groups in the Asian and Caucasian diaspora. But not to get ahead of myself, let's go back to looking at some other studies. This study titled, quote, Diversity in Human Hair Growth, Diameter, Color, and Shape by Genevieve Losvorn and colleagues at L'Oreal Research and Innovation provides an insightful analysis into the diverse characteristics of human hair across various ethnic groups. Focusing on young adults from 24 different ethnic groups across 5 continents, the study utilized principal component analysis and hierarchical ascendant classification to examine hair growth parameters such as density, growth rate, and telogen percentage, as well as hair diameter and color. The results identified 3 major clusters representing classical hair types of African, Asian, and Caucasian ethnicities, which were further differentiated into 7 sub-clusters. Now, a key finding was that Caucasian scalps have about 30% more hair than African or Asian scalps, so that's interesting, indicating a significant difference in hair follicle density. Now, in contrast, Asian hair showed the fastest growth rate, potentially growing 5 centimeters longer than African hair in 1 year. Interestingly, these variations appear to be genetically influenced rather than environmentally, as there are very few differences noted between the subjects of a given subgroup living in different locations. Although hair diameter was not measured in all subjects, the observed variation aligned with previous research, particularly highlighting differences in Asian hair. The study's comprehensive approach offers valuable insights for understanding ethnic variations in hair characteristics, which is crucial for fields like dermatology, trichology, and cosmetic product development, ensuring tailored hair care solutions for diverse populations. Now, this next section, we're going to be looking a bit more at hair transplant procedures and really examining the dynamics of the hair follicle and how the hair follicle grows underneath the skin, as well as how the hairs come out of the hair follicle, and how hair transplant surgeons deal with these unique challenges when it comes to different ethnic groups, and just the various ways in which hair can grow and manifest in, different looks. In a medical practice write-up and literature review titled, quote, Ethnic Considerations in Hair Restoration Surgery, unquote, Jeffrey Epstein, and no, not that Jeffrey Epstein, the guy who committed all those unspeakable crimes. This is a different Jeffrey Epstein. This is the Miami plastic surgery and hair transplant specialist, Jeffrey Epstein. So get that in your head. It's that Jeffrey Epstein. But along with Anthony Bard and Garona Kuka, MD, the 3 explored the growing trend of diverse ethnic groups seeking hair restoration surgery, reflecting demographic shifts in the United States. And here we can get these hair transplant surgeons' understanding of the challenges that different ethnic groups and their hair face when undergoing hair transplant procedures. And this section mainly, right, is to show how different the hair follicles and hair of these different ethnic groups can be, particularly focusing on their hair count dynamics that each hair follicle produces. So let's delve into that. So these 3 hair transplant specialists, their practice serves a predominantly non-European, non-white clientele. So I guess you can say it's very ethnic because at least in the context of the United States, there are more so-called whites or European people than other ethnic groups. So we can really look at the differences in hair follicles. And they have clientele coming from various regions, including Latin America, the Middle East, and Asia. And they've also observed an increasing number of African American, Middle Eastern Asians, East Indians, and Hispanics, all these groups, right, seeking hair restoration. Now, the primary procedure performed in their practice is hair grafting or hair transplantation. And these ethnic considerations that must be taken into account include the density, diameter, shape, and mechanical properties, as well as composition of hairs that vary distinctly amongst Asian, white, and African hair. So again, depending on what group you belong to, it would necessitate that these surgeons use a particular hair transplant technique to accommodate. The medical write-up notes the round follicle shape of Asian hair, the elliptical shape of African hair, and the intermediate shape of white hair. And these sort of dynamics contributes to the coverage of these hairs, how these hairs go about covering the scalp, as well as their perceived visual density and their actual density by hair number count. It's noted that African hair has less tensile strength and breaks more easily. while Asian hair follicles are more metabolically active, making their hair grafts more vulnerable to dehydration. The density of hair, a crucial factor in transplantation, is influenced by the concentration and the caliber of individual hairs, with Asians having the largest cross-sectional diameter and high proportion of single hairs coming out of these hair follicles. So what is this saying? What are these hair transplant specialists saying about Asian hair? Well, what we learn once again is that Asian hair tends to be thick, wide, which contributes to its own unique density factor. However, within Asian hair, there is a higher representation of single hair follicles. Now, this is in contrast to African sub-Saharan, black African sub-Saharan hair, which typically has a decent density compared to Asian hair. And by density, I mean like hair count density. And that's the advantage of the number of hairs that come out of each hair follicle. But in the case of African scalps, it would be that although they have a high degree of multi-hairs coming out of each hair follicle overall on their scalps, African scalps tend to have a lower hair count in general, but they do tend to have these 2 to 3 to 4 hair grafts. But not only that, but due to the nature of the curly hair, the curl nature of the hair, it maintains a greater degree of coverage, which contributes to an illusion of greater density. And I just want to preface this by saying, just because I said an illusion of greater density, that doesn't mean that Africans don't have great density on their scalps or dense hair in general. It's the fact that when you consider things like hair thinning and hair transplants, you can create a greater density, or things can be kind of masked from how bad they actually are just because of the curly nature of the African hair. So when I say an illusion of greater density, don't think like black people or Africans in general, or sub-Saharan Africans in general, look like they have dense hair, but they don't. They may very well have dense hair, or they may not. It's just that you wouldn't know because of that greater degree of coverage that that hair has. And again, that is a plus when it comes to hair transplants. So with that, people who have that African curly hair can get away with using less hair grafts due to that curly nature of each individual hair coming out of each individual hair follicle. And also keeping that in mind, when these people undergo treatment with, again, that coverage, that curly hair coverage, the hair that does come back to its natural anagen phase will likely make them look like better responders than they actually are. So a African Norwood 2 probably looks better than a Caucasian Norwood 2. An Asian Norwood 2 probably looks better than an African Norwood 2, or about the same as an African Norwood 2. And an Asian Norwood 2 probably looks better than a Caucasian Norwood 2. It's just due to these intricate dynamics between, Asians having wider hair follicles that grow very long and very fast, and Africans having curlier hair that tends to lay low on the scalp and maintain better coverage. These are the advantages between these two groups versus, I guess you can say typical. When I say typical, just a straight hair Caucasian. In hair transplantation, when you take out a hair follicle, sometimes it may have 2 to 3 hairs, but depending on your ethnic group and what you belong to, you may have a higher prevalence of single hair follicle grafts, or maybe like, if you're lucky, you could have like 3 or 4. I've seen some pictures of a hair follicle producing like 5 strong hairs. That's crazy. But we can see that there are different ways to get density, right? Again, you can have thick hairs themselves, thick hair shafts, or you can have a lot of hair counts coming out of those hair follicles. So it kind of varies between groups and individuals, but density is kind of like this factor. Within this one single factor of density, there are multiple ways to achieve density. Looking back at the L'Oreal Diversity in Hair study, you can see both West Africans and African Americans, who, by the way, typically have, I think it's around 15 or 10 to 25% European DNA, but both seem to have decent hair densities. In fact, on hair density alone, in terms of hair count per hair follicle, or within some sort of determined measurement, these Afro-descendant people beat out several Asian groups as well as Caucasian groups. This so-called black sub-Saharan based hair curl maintains good coverage due to its curl pattern. So with the Afro-esque hair type, you have density and coverage, which makes the hair much more fuller, I guess you can say, than Caucasians, and somewhat on par with Asians, or maybe a bit less than with some Asian groups. But again, it depends on the Asian group you're going to be looking at to compare to the particular sub-Saharan Black African group. So already we can get a sense of what's going on. By their very nature, Asian hair tends to be wider, and I keep saying this over and over again, but I want you guys to get the point. When these hairs go back to their normal anagen phase, in Asian Norwood 3 and Afro Norwood 3 is probably due to the hair dynamics, its coverage and such, its characteristics, its features, they're probably going to look better than a typical Caucasian Norwood 3. And we get a better insight into especially the Afro hair and its curl by looking at this one particular hair transplant surgeon, Dr. Alba Reyes's approach to FUE treatment, as discussed in her study, quote, "Curly hair FUE, my approach using classification of follicle curvature and curl by Alba Reyes, MD," unquote. And Dr. Reyes elaborates the unique challenges of performing FUE on curly hair commonly found in individuals of African descent. The literature underscores the distinct nature of curly hair and suggests that in hair transplantation, individuals with such hair often require fewer grafts due to its inherent coverage. So notice the point. When it comes to hair coverage, you can give more of the illusion of density, meaning you're kind of using the nature of the hair itself to create the illusion of it being packed, and visually, again, having a visually better Norwood 3 in one group than the other. So I guess my question here is, and my line of thinking is, how do these dynamics, at least from people that say, well, Asians that take finasteride or dutasteride, it's because of some sort of intrinsic reaction between the hair follicle and the finasteride and dutasteride that's separate from other groups, right? How do these dynamics between ethnic groups, from the length of the anagen phase, integrity of the hair shafts, width and weight of the hairs, as well as other factors, how do these differences dictate whether someone will respond to finasteride or they won't respond to finasteride? Likewise with dutasteride. Because I think that is the part that people are confusing. It's not to say that other groups won't respond as well. They'll respond as well. Like if it is dictated that it tends to be the case that Norwood 4s can get back to a Norwood 3 if they take finasteride or dutasteride, let's say that's the case, right? Now, when you examine that and take into account the length of the anagen phase and how the hairs actually look like when they come back to their original anagen growth cycle based on the ethnic group, again, you may see that in Group A, because they have unique hair characteristics, their hair typically being more dense and wider and such, maybe those people of that ethnic group, again, their Norwood 3 probably looks like a Norwood 2, and they used to be a Norwood 4, so they have this crazy-ass response, right? Visually, at least. But in reality, they're still going from that Norwood 4 to Norwood 3. It's just the look of the hair kind of gives the illusion of it being better than it actually is. So we're going to be looking at some finasteride 10-year studies on Japanese men, as well as we're going to be looking at the 5-year dutasteride study on Korean men. And we're also going to be looking at the 10-year long-term efficacy study that was performed in Italian men. So hopefully you guys are able to follow along with my spiel and we can actually delve deeper and try to go down this rabbit hole of it not being some sort of intrinsic response or unique response between the hair follicle and finasteride or dutasteride, but rather it's just these ethnic groups, they have their own intrinsic unique hair characteristics, such as diameter and the coverage, that when they go back to their original anagen growth phase, and I'm being repetitive, but I want you guys to get this, when these hairs of certain ethnic groups go back to their original anagen growth cycles, that's when you start to see that, okay, they have other advantages outside of finasteride or dutasteride response. So yeah, let's get a look at those studies. Now, when it comes to long-term finasteride studies, this one definitely stands out. The study titled, quote, "Long-term 10-year efficacy of finasteride in 523 Japanese men with androgenetic alopecia," unquote, by Masayuki Yanagisawa and colleagues, presents a thorough evaluation of finasteride over a decade. Involving 523 Japanese men, This research stands out to be one of the first of its kind to assess the long-term impacts of finasteride on the hair growth cycle. Now, the results were very impressive, with 91.5% of participants experiencing hair improvement and 99.1% seeing prevention of disease progression, as assessed by both the Norwood-Hamilton scale and the modified global photographic assessment score that the researchers came up with. These findings were reinforced by subjective evaluations where patients reported high satisfaction levels and perceived improvements in their hair condition during the duration of the study. Now, the study also noted minimal safety concerns with only mild and temporary adverse reactions reported in a small fraction of participants. This research is particularly significant as it provides substantial evidence of finasteride's long-term efficacy and safety in treating androgenetic alopecia. When it comes to the modified global photographic assessment scores for each Norwood-Hamilton group, it increased progressively, with the most significant improvement observed in the stages between Norwood-Hamilton 3 and 4. Men in the earlier stages of androgenetic alopecia, so these are stages 1, 2, and 3, at their initial visit exhibited greater improvement with long-term finasteride treatment compared to the latter stages. So essentially this means if you are early to treating your hair loss, you will get better hair gains or retention to your hair long-term. Furthermore, the overall improvement in the modified global photographic assessment for the entire study population, particularly those in the earlier stages of hair loss at the first visit, was significantly more pronounced from the 5th year to the 10th year of treatment. Now, this indicates that while finasteride was effective throughout the whole 10-year period, its impact on the hair growth improvement was more noticeable during certain years, especially in the latter half of the study. So the final 5 years, that's when things started to really pick up speed and the hairs started to grow properly, perhaps becoming desynchronized in their initial synchronized growth pattern. We get a sense that after the 10-year period, there were times of decline in hair counts. However, things generally stayed above baseline, as noted by this graph on the screen. The research conducted by Ji-Hoon Lim and colleagues from the Kyunghee University Hospital in South Korea has shed light on the long-term effectiveness and safety of dutasteride in treating androgenetic alopecia. In their clinical paper titled, quote, "Long-term efficacy and safety of dutasteride in Korean men with androgenetic alopecia, 5-year follow-up data exhibiting clinical improvement with sustained efficacy." The study results are very promising. Dutasteride showcases a high rate of efficacy, with almost 90% of patients observing an improvement or halt in the progression of androgenetic alopecia after a 5-year treatment regimen. When the results were dissected using the BASP classification, it became evident that dutasteride's effectiveness varied based on the specific hair loss patterns. Patients categorized under the specific V type showcased the highest rate of improvement, trailed by those under the specific F type, and finally the basic category. Now, what might be the reason for specific V and F outperforming the basic group? The BASP classification reveals that patients with the specific V type, indicating hair thinning around the vertex, saw the most significant treatment improvements, at least when it comes to this particular 5-year long-term dutasteride efficacy study. The reason for this could be due to dutasteride being particularly effective in this region, or the hair follicles there might be more responsive due to factors such as hormone sensitivity to DHT. Conversely, those with the specific F type showing general thinning across the scalp, especially frontally, experienced lesser improvements compared to the specific V type, but nevertheless, they did get improvements overall, potentially because of the diffuse nature of their hair loss or frontal region's resistance to treatments. Meanwhile, the basic category, focused on the anterior hairline shape, showed the least improvement. This could be due to the entrenched nature of hairline recession, or it could be that the basic hair loss pattern, the way in which hair follicles miniaturize in that specific pattern, is much more destructive. but I'm just spitballing here. Again, overall, 90% of people in this study either improved or witnessed a halt in their hair loss. When it comes to people who improved, only 52.5% of patients belonging to the basic type showed improvements. Now, that doesn't mean that people got worse, that just means that people improved. For the specific F type, 75% showed improvement, and for the specific V type, 83.3% showed improvement. So again, overall, if you take dutasteride, about 90% of these 99 patients showed improvement. Now, don't get mad at me because I already uploaded that video, and I'm sure some of you guys can tell that I already uploaded that previous section on the dutasteride 5-year long-term study. But this study primarily focused on Korean men. And again, when we look at the literature, when it comes to Asians, Koreans, Japanese, and even some Chinese, these sort of East Asian groups have a wider window, meaning their hair loss rate occurs slower than other groups. So when they do take treatment, it tends to be at a stage that is less severe compared to other groups. Now, I would say that when you normalize for specific Norwood scales, so if you get some person who's of East Asian descent who's at a true Norwood 3 versus a Caucasian at a true Norwood 3, and when we put them through the same medications, you will most likely see comparable hair gains. And as another reminder, Asian hair, the individual hairs themselves that come out of each hair follicle, right? They tend to be wider and they tend to have a faster anagen growth phase and a longer anagen growth phase. So just taking all that into account, you will see this so-called hyper-responder when they take finasteride or dutasteride. The study titled, quote, Finasteride 1 mg daily administration on male androgenetic alopecia in different age groups 10-year follow-up, unquote, was conducted by Rossi et al. At the Department of Dermatology and Plastic Surgery, University Sapienza of Rome, and CASPER, the Inter-University Consortium for Supercomputing, Rome, Italy. The research aimed to assess the long-term efficacy and safety of finasteride in treating male androgenetic alopecia over a 10-year period. The study was an uncontrolled long-term trial involving 118 men aged 20 to 61 years, diagnosed with mild to moderate androgenetic alopecia. These men were in good physical and mental health, as the study states, and the study went on to exclude individuals with significant physical or laboratory abnormalities, as well as those who had prior surgical correction of their hair loss via hair transplantation, those who used topical minoxidil within the last year, consumed drugs with androgenic or anti-androgenic properties, or had hair loss causes other than androgenetic alopecia. Each participant was administered 1 mg per day of finasteride. The treatment's efficacy was gauged through a standardized global photograph taken at the start, the baseline, and then after 1, 2, 5, and 10 years of treatment. These photographs were evaluated by a panel of 3 experts, including 2 experienced dermatologists and 1 junior dermatologist, who compared the photographs and assigned a score from -3, the greatest decrease, to +3, the greatest increase of hairs compared to baseline. The results indicated that finasteride is effective in treating male pattern baldness. Notably, better improvements were observed in patients older than 30 years and those with higher androgenetic alopecia grades. About 42.8% of patients aged between 20 and 30 years showed no improvement even after 10 years. In contrast, patients with androgenetic alopecia grade 4 and 5 started showing improvements after just 1 year of treatment. Interestingly, the study found that continuing treatment beyond 5 years led to better results in 21% of cases. By the way, when I said 42.8% of patients between age 20 and 30 years of age showed no improvement after 10 years, this is about improvement of hair growth. So it's essentially saying people did not gain hair. They were just at the same spot where they started, essentially. So, in other words, these people were stabilized at their current point of hair loss and may have even experienced some sort of thickening up of hair. In addition to the grade 4 and grade 5 and I'm assuming this is the Norwood grade 4, Norwood grade 5 patients that were taking finasteride. It stated that they started showing improvements after just 1 year of treatment. And it could be the case that they started showing improvements because they didn't have that much hair to begin with. This could be due to there being a significant improvement of hair that is to be gained once it is gained in those who have gone without it for an extended period of time. So in other words, if hair is to be gained, the differences is more dramatic in, say, a Norwood 4 versus a Norwood 1. The efficacy of finasteride did not diminish over time. In fact, many patients who did not show improvement in the first year experienced positive results later on. So this is why for people who complain about not seeing improvements within the first year, don't stop using the drug. You may very well get improvements a year and a half, maybe 2 years into treatment. So just stick with it. A small percentage of patients experience side effects related to sexual function, which in some cases led to discontinuation of the treatment. Now, that's nothing new. We've already known about sexual dysfunction and side effects when it comes to using finasteride, but it is not permanent, as the post-finasteride syndrome fearmongers would say. It's not permanent, and if you look at my channel, I have other details about how to overcome side effects, but that's not the point of this video. But I digress. The study highlighted that the majority of patients who saw improvements within the first 5 years continued to maintain or improve their hair growth in the following years. Now, I want to make a quick break in here. If you can remember the 10-year long-term Japanese finasteride study, it was observed that even after 5 years, people who continued to use finasteride kept seeing more gains. So what you have to keep in mind is that your 1 year result isn't necessarily where you're going to be, right? It probably gives you an indication that you're responding. If you're shedding, right, then that means you're getting an indication that you're responding to treatment. But just because you've hit 1 year of treatment and you're not seeing improvements, it doesn't mean that you're not going to make any gains. It could be 2 years down the line. You could be having progressive shedding along the way that kind of masks how your hair follicles are recovering after getting rid of DHT. Because a lot of people don't seem to understand this, right? When you start taking finasteride or dutasteride, as soon as you lower the scalp DHT, depending on what growth state your hair follicles are currently in, what phase of the anagen phase they're in, right? It's been observed that if these hair follicles are in a similar anagen growth phase, they'll begin to synchronize their growth patterns. And again, as these hair follicles recover, as they go through their growth and shedding cycles, they'll become more normalized and eventually lose that sort of synchronized nature to them. So when you look at the Japanese study and that graph that's in there, you can see that over time, people are above baseline, but you have these like periods where, hair count goes up, hair count goes down, but overall, the trend is upward in terms of hair count and hair improvement. And we're going to go back to the Rossi study that I was talking about, the 10-year finasteride efficacy study in Italy. The Rossi study sort of reiterates what the Japanese study showed us. The Rossi et al. Study provides detailed data on the progression of hair growth in patients treated with finasteride over 10 years, particularly highlighting the differences observed at 1 year, 5 years, and 10 years. What we find is that after the first year of treatment, there was a notable improvement in some patients. The study particularly emphasizes that the first year can be somewhat predictive of the treatment's overall effectiveness. So if you start shedding, if you start growing some hair, this shows that you may be a responder, but it doesn't necessarily say that people who don't necessarily have a huge growth rate or a huge growth response aren't going to see any improvements. It was observed that older patients, like I mentioned before earlier, and those with higher androgenetic alopecia grades responded better in the first year compared to younger patients and those with lower androgenetic alopecia grades. By the 5th year, there was a continuation and in some cases an improvement in hair growth for those who had shown positive results in the first year. For those who did not observe improvements in the first year, about 25% showed improvements by the end of the 5th year. The persistence of hair growth or further improvement in hair quality was a significant factor among patients who initially responded well to the treatment. At the 10-year mark, The study observed that patients who showed improvement in the first year had a higher probability, 68%, of further improvement or at least maintaining their hair growth. However, there was a noted decline in the effectiveness for some patients between the 5th year and the 10th year. This decline was not predominant but was significant enough to be noted. Approximately 14% of the patients experienced a worsening of their hair condition by the 10th year. Now, despite this decline for a subset of patients, the overall effectiveness of finasteride at the 10-year mark was still higher compared to the first year. This suggests that while some patients may experience a decrease in effectiveness of the treatment over time, the majority either maintained or improved their hair growth. Now, when looking at the tables, you may notice that there is a decline in hair counts between year 5 and 10. However, overall, year 10 is better than year 1, the baseline. There may be some reasons for this decline between year 5 and 10. The observed decline in hair growth effectiveness between the 5th and 10th years of finasteride treatment, as reported in the study, could indeed be influenced by factors such as seasonal shedding, general aging, a desynchronization from the 5th year of hair growth, and finally, although DHT's effects were significantly slowed down in some patients, it could be finally catching up to these patients. Because we know that finasteride at 1 mg or 5 mg only decreases scalp DHT by 40%. So for these men who are observing a decline in hair count or hair growth between year 5 and 10, but still being above their baseline year 1, they may be candidates for dutasteride, because you can achieve a greater degree of scalp DHT suppression depending on the dose range between 0.5 mg dutasteride up to 2.5 mg dutasteride. And within those milligram dosing ranges, right, at one of those doses a day, you can suspect a decrease of scalp DHT between 50% for 0.5 mg dutasteride a day, up to 80% for 2.5 mg dutasteride a day. So this decline in apparent effectiveness offers a more nuanced understanding of the long-term effects of finasteride treatment. But overall, the study's findings were very positive. Patients on average remained significantly above their baseline in terms of hair growth and quality after 10 years of continuous finasteride treatment. And this only goes to underscore the long-term effectiveness of finasteride in managing androgenetic alopecia, with most patients maintaining or improving their hair growth compared to their initial state before beginning their treatment. Now, I decided to make some heat maps to help us look at the data from the Rossi et al. Study. Hopefully I didn't make any mistakes here, but I want to actually just make things look a bit better and a bit clearer for people. The first heat map we are going to be looking at is the heat map for 1 to 5 years of finasteride treatment. This heat map shows the likelihood of a patient's condition in the first year of treatment changing or staying the same by the 5th year. And when I say changing, I mean worsening or growing or improving or whatever, right? For example, if a patient's condition improved in the first year, there's a 53% chance that this improvement will continue or get better by the 5th year. It does not mean that 53% of all patients improved, but rather that among those who improved in the first year, 53% continue to see improvements over the next 4 years. And you can see that in this sort of heat map that I have on the screen. Now, the heat map for 1 to 10 years. Similarly, this heat map indicates the probability of changes in a patient's condition, hair condition that is, over a longer period of time, from year 1 to year 10. For instance, if someone's condition improved in the first year, there's a 68% chance that they will either maintain or see further improvements in their condition by the 10th year. Now, the heat map comparing 5 to 10 years, so the 5 to 10 year range, this heat map focuses on the changes or stability in the patient's condition from year 5 up to year 10. It shows that if a patient's condition improves by the 5th year, there's a 73% chance that this improvement will peak in its effectiveness or persist by the 10th year. So let's do a deeper look here between year 5 and year 10. The transition probabilities between 5 and 10 years per patient. So if you're not looking at the screen, please look at the screen now. But if not, I guess I can kind of verbalize what's going on. You have a heat map with values, right? And we need to understand what these colors mean. Darker blue. So the darker blue indicates higher probabilities of the afflicted male pattern baldness individual's condition remaining stable or improving from year 5 to year 10. For example, the darkest blue square with the value of 1 indicates that all patients with the highest positive response at year 5 remain positive at year 10. The lighter blue and green areas, these are the lower probabilities, indicating that a lower likelihood of the condition remaining the same or less certainty about the outcome. For instance, a light blue square with the value of 0.14 suggests a smaller chance that the patient who had no change at year 5 would see improvement by year 10. The yellow-green tones, or the yellowish-green tones that we see, represents the lowest probabilities. For example, a yellowish-green square with the value of 0 indicates a very low probability of transition. So this heat map provides a visual representation of how a patient's response to finasteride treatment for hair growth evolves between the 5th and 10th year of treatment in this study. Looking at the horizontal axis, we have the response at the 5th year mark, values ranging from -3 to 3, positive 3, right? So negative numbers indicate worsening of the hair growth as according to the researchers and how they rank them, while positive numbers indicate improvements. The vertical axis shows the response at the 10-year mark using the same scale. The color intensity within each cell reflects the probability of a patient transitioning from their 5th year response to 10-year response, with darker colors denoting a higher probability. The cells that fall along the diagonal line of the heat map are particularly noteworthy, as they indicate the probability of a patient's condition remaining consistent over time. For example, a cell intersecting the point where both the 5th year and 10-year responses are marked as 1 exhibits a probability of 0.73. This suggests that patients who were in a slightly improved state at the 5th year checkpoint had a 73% chance of maintaining that level of improvement the 10th year mark. Looking at the cells that do not fall in the diagonal line provides insights into the changes in patients' conditions. Take, for instance, a cell where the 5-year response is 0, signifying no change, and the 10-year response is 1, indicating improvement. This cell has a probability of 0.14. This indicates that there was a 14% chance that patients here who saw no change at the 5th year mark would experience improvements by the 10th year mark. So this might be saying that, hey, some people hit their peak at the 5th year mark. Maybe that's all you can get in terms of your hair growth, and from there, you're going to be shedding, going through seasonal sheds. Your hair might be going through another synchronized shed. And finally, it's just the fact that DHT is still present in your scalp. And this could be a progression, albeit a very slower progression of your natural hair loss. So again, some people here might start to look at dutasteride. But at year 5, there's about a 14% chance that patients who didn't experience any change, so any growth of hair, would go on to see some sort of great improvement at the 10-year mark. It's most likely that they just stay the same. So from this heat map, we can see some probabilities where patients lost some hair between year 5 and year 10. They either didn't improve because they capped out in their hair growth, or they got a little bit of improvement up to year 10. But it seems to be the case between years 5 and 10, people were still above their baseline. So year 10 was better than year 1. So because making heat maps are pretty fun, let's do something similar with the 10-year Japanese study. The study titled, quote, Long-Term 10-Year Efficacy of Finasteride in 523 Japanese Men with Androgenetic Alopecia, unquote, by Masayuki Yanagisawa and colleagues, presents a thorough evaluation of finasteride over a decade. Here, the first heat map we're looking at is the yearly modified global photographic assessment scores that the researchers gave to individuals in this particular study. So it goes from year 0, the start of the study, up to year 10, and you can see what scores the researchers gave individuals in different NORD classes. Now, the researchers give a score starting with 0, essentially being baseline, 1 being significant disease progression, so that means the hair loss got worse, 2 being moderate disease progression, so that means the hair loss is slowing down, but still progressing somewhat, 3 being slight degree progression, so it's significantly it's still progressing, but it's barely progressing, 4 being no change at all, so stable, 5 being a slight improvement in hair, 6 being a moderate improvement in hair, and 7 being a significant improvement in hair. These are the scores that the researchers gave, and this is how we're going to conceptualize this heat map. So looking at the vertical axis, the rows, this represents different Norwood Hamilton scale groups ranging from 1 all the way up to 7. These groups are indicative of the severity or stage of hair loss at the first visit, so at year 0, when researchers started the experiment. The horizontal axis, or columns, represents the years from 0 to 10. Now, the color scale. The color intensity in each cell indicates the modified global photographic assessment score that we mentioned before that the researchers came up with. Warmer colors, so the more red they are, denotes higher scores, while cooler colors, the more blue or bluer they are, represents lower scores. Each cell value contains the modified global photographic assessment score for a specific Norwood Hamilton group at a particular year. The values are means indicating the average modified global photographic assessment score of individuals in that group for that year. From this heat map, we can observe trends. Generally speaking, the modified global photographic assessment scores indicate increasing over time for all groups in this 10-year long-term Japanese finasteride study. Now, some Norwood Hamilton classes had more positive outcomes, and these tended to be, like I mentioned in the beginning of this long video, the Norwood classes 1, 2, and 3 had significant changes to their hair count and quality. Beginning of this long video, the Norwood classes 1, 2, and 3 had significant changes to their hair count and quality over time, better than the other Norwood classes. So this indicates differences in how various stages of hair loss responds to treatment. So what should you take away from this, right? The sooner you respond to your hair loss, the better outcome you'll get. If you're a Norwood 1 to 3, you'll get a better outcome compared to a Norwood 4 to 7. So next, for our heat mapping, we're going to focus on the mean modified global photographic assessment scores over 3 specific year ranges: the 1 to 5 year range, the 5 to 10 year range, and the overall 1 to 10 year range. Again, this specific graph that you're looking at right now on the screen pertains to the long-term 10-year efficacy of finasteride in 523 Japanese men with androgenetic alopecia study. Anyway, the vertical axis or rows, again, the different Norwood Hamilton scale groups are displayed. The horizontal axis or columns, this time the columns represent 3 time ranges: the 1 to 5 years, the 5 to 10 years, and the 1 to 10 years. Now, when it comes to the color scale and the cell values, similar to the previous map that we were just looking at, the color intensity and the cell values indicate the mean modified global photographic assessment score for each group over the specified time ranges. Now, this map helps us in understanding the average response over broad time periods, which smooths out year-to-year variation, and it also allows us to have a comparison between the first half, the 1 to 5 years, and the second half, the 5 to 10 years of the decade-long period. And this gives us some meaningful insights that shows us whether the effects of the treatment, the finasteride, either strengthen, weaken, or remain consistent over time. The overall decade-long effectiveness of treatment across different stages of hair loss, both heat maps together provide this sort of detailed and nuanced view. Now, when you're looking at the graph itself, as you can see, people with a Norwood Hamilton 1, they typically had good responses, right? Remember, the response scale is from 0 to 7, with 0 being, you didn't get any improvement whatsoever, with 7 being you actually grew hair and you just were a fantastic responder. What you can see is that between the 1 to 5 year mark, you had people have somewhat reasonable hair gains. And those people are mainly in the Norwood 5, I would say, and up. So Norwood 5 to Norwood 1, these people typically had good responses. Now, trending from that time period, going to the 5 to 10 year range, you can see that people who were Norwood 1, Norwood 2, Norwood 3, and even Norwood 4 had some pretty good hair gains. Now, what I thought was particularly interesting was that the people who responded well and were actually getting good results between the 5 to 10 year mark and the 1 to 5 year mark, you can see that a lot of people experienced continual gains between the 5 and 10 year marks more than their 1 to 5 year marks. Or at least that was the average scores that each Norwood class tended to give. So the mean score in year 1 to 5 was lower than the mean score between years 5 to 10. But hopefully the graph is somewhat self-explanatory. I don't want to belabor the point, but you can see that, yes, scores in terms of positive hair growth markers are trending upwards. So, taking a step back, looking at both of these studies, the 10-year finasteride study that Rosie et al. Did for the Italian men, as well as the 10-year finasteride study that Masayuki Yanagisawa did for the 523 Japanese men, we see that overall, people in these studies are experiencing changes, positive changes, such that when people reach year 10 of their finasteride treatment, their hair is better than when they started out. And then we see some things like year 5 or the intermediate stage of the treatment, so the halfway mark point, tends to see people either continually improve or stagnate in their hair gains or hair growth. These 10-year long-term finasteride studies show that early response is better than later response, right? So the more proactive you are in addressing your hair loss, the more likely you are to keep your hair. And because we have an example of a Caucasian population, being these Italians, and also an East Asian population, being Japanese, we're seeing, again, the same trend. People have better results at year 10 than they do at year 1. And at year 5 to 10, that is sort of like an intermediary point where people either stagnate or they make continual gains, and a small minority of them see a decline in hair count. Nevertheless, they're still above their baseline where they started out at. So I think that kind of blows a bit of a hole into the whole hyper-responder to the finasteride or dutasteride thing that many people have when it comes to Asians. Because people will use the excuse that, well, Asians are hyper-responders, so what's the point of me using finasteride or dutasteride? Which I think that's kind of said in a hyperbolic manner on these online forums. But really, some people excuse finasteride even working or not working as well because they'll just say, well, the study you cited uses East Asians and East Asians just, intrinsically respond better to finasteride. And that's not completely true. When you control for factors such as their Norwood scales, and how soon they address their hair loss with finasteride, you'll see that the people who were quicker to act kept their hair longer and were the ones that tended to have greater efficacy. I'll say this, in terms of the visual appearance that some people see on these forums, I'm willing to bet that it's just the dynamics of Asian hair, it being wide, it being faster in terms of its anagen growth rate, that when these hairs do go back to their original anagen growth cycle, they'll just look aesthetically better than typical long, wavy Caucasian hair, right? The thick, wide hair of Asians, East Asians in particular, kind of fills out and just looks, I guess you can say, better, right? When it comes to hair growth on finasteride. And another factor being that, like I mentioned earlier in this video, and in case if I cut this up, I'll just mention the factor again, that East Asians do have a slower rate of androgenetic alopecia So if you don't control for things such as the Norwood class of these androgenetic alopecia treatments, you will have that perceived hyperresponder. But get an Asian Norwood 1 and a white or Caucasian Norwood 1 or an Afro Norwood 1, they'll all tend to respond the same. But yeah, long ass video, a lot of graph reading here and there, but hopefully my message is able to be conveyed properly. And if you guys have any comments, please feel free to leave them in the comment section. Anyway, thank you for watching, and I hope to see you guys on the next video. Comment green star if you got to the end of this video. Peace out, guys.